experts have warned that the number of mothers who die after a cesarean section in Africa is almost 50 times higher than in developed countries. According to an observational study published in the Lancet Global Health journal, 5.43 deaths per 1,000 operations are recorded in Africa, compared with 0.1 deaths per 1,000 operations in the UK. The findings highlight an urgent need to improve the safety of cesarean operations. It is the largest study of its kind, tracking maternal mortality and complications during birth for women in Africa. Benin, Burundi, the Democratic Republic of Congo, and Zimbabwe were among the 22 countries studied. Well, for more on this, we're now joined in studio by Dr. Kireki Omanwa. He's an obstetrician, gynecologist, and fertility specialist here in Kenya. Thank you so much for your time, Doctor.
You're welcome.
It's a shocking statistic in 2019 that women in Africa are 50 times more likely to die from a C-section than women in Europe. Why is this the case?
Thank you very much for inviting me to the studio to talk about this very important finding. Surprisingly, these are some of the things that we know. According to the study, actually most of these complications were because of severe intraoperative and post-operative bleeding. We know that that is a problem. Apart from that, some of these complications were because these patients came to the hospitals because of other issues, for example, what we call placenta previa, abruption of the placenta, ruptured uterus, and so on and so forth. Some of these complications can actually be sort of, we can think about them, we can plan. For instance, if you have a patient with placenta previa, this is a patient who can be followed up in clinic and can be planned on what to do cesarean, if we were to go for a cesarean section. But when they come and they are bleeding, then we have to do something about it. One of the biggest problems we have is getting blood. We have a lot of intraoperative bleeding, post-operative bleeding. Sometimes the medications that are needed to sort of stop this bleeding, what we call ureterotonics, to stop the uterus, to contract the uterus, they may not be very readily available. Or if they are readily available, they may not be working the way they are supposed to work. Why? Because of some of the conditions that are expected to be stored in. One of the most straightforward drug that is used for contraction of the uterus actually is supposed to be kept in a refrigerator. So you find in some places there could be a refrigerator, or there could be no refrigerator at all. Or if there is a refrigerator, there is no electricity. Or if the electricity is there, it is fluctuating. So these are some of the things which actually can lead to such issues.
And when we look at the responsibility, or the fact that the onus really is on governments and health departments across the continent,
yes,
are they essentially failing African women in providing adequate resources for these types of emergency cesareans?
I think it's important, it's imperative that, and it's very important that you've raised that issue of government. It's very, very important because government actually have a huge role in this because they are the stewards of our health. So if the governments are not planning, if the governments are not investing enough, investing in training, personnel, doctors, nurses, midwives, and so on, investing in equipment, equipping hospital with the right equipment, with the right people, investing in medications, even if they are a little bit expensive, it is possible actually to have all these things. So it is a continuum. It's not something, it is not a problem which we can solve, in bits and pieces. We have to put all these bits together. And then apart from that, there is the Millennium Development Goals, which African governments actually signed on to. And the aim of that was actually to increase the finance of healthcare, which unfortunately has not happened. So yes, in a way, African governments are actually failing African women.
And on that, though, I mean, around the world, there's talk of C-sections actually coming down, the number of C-sections being performed. Yes. But others suggesting that that number actually needs to increase in Africa, that there should be more access. What are your thoughts? My
thoughts are the C-section should be safe, whether it is increasing or whether it is decreasing. In this part of the world, access to healthcare is a problem. And for instance, if you find patients living 100 kilometers away or 250 kilometers away from a health center, not even a hospital, a health center, if such a lady starts laboring and she labors for 2 days, 3 days, cannot be able to access help, clinical help. And by the time she gets to where this help is available, we find it is too late. And this is a problem. So it is not a question of the C-sections increasing or decreasing. It is the safety of these C-sections. While we are still on it, I think, again, as I mentioned about human capital, we should actually focus on training our specialists, not task shifting to other cadres who may not be as well trained to actually undertake some of these serious surgery. C-section is major surgery, but because some of the cadres may have done maybe 1 C-section and 2 C-sections, and they think that they are capable of doing C-section, then it becomes a problem because they run into complications, they run into trouble, and they do not know what to do, and they may not have the ability to anticipate what to do or what to do in case they run into complications.
Doctor, thank you so much. We'll have to leave it there, but thank you so much
Thank you
for sharing your thoughts. Dr. Omanwa here with us in our Nairobi studio.